but it lives in another document. So, we're all familiar around that process, and we're evolving to being peaches in the upper right quadrant, where we're all tasty and everything's easy. And, as most of you know, that still isn't the case, but we're still evolving the conversation of how do we leverage longitudinal data for risk prediction. And those of us in the States, we also have this value-based payment reforms. So we really have to be accountable for how we are capturing our data and the quality of the data, especially with the patient as a blockbuster drug now, is how they like to say. And we also have to be able to communicate with those patients as well. So, where do we start? This is our Lego slide. So where do we start, Nicola?
Well, I'm not sure that there's an easy place to start wherever, but we have to pick somewhere and just get started is the one thing that I always like to say, because if you say this is our Lego box, there is so much we can choose from that it's very easy to be overwhelmed when you start doing a data governance initiative. But actually, it's a bit like that child's joke. Well, it was one that I remember from being a child, is the how do you eat an elephant in bite-sized chunks. So if data governance is our elephant, it's like this Lego box. We can't fix it all and get it all perfect, but we can choose one bit and start there and then just move forwards iteratively.
Yeah, I see there's one of these little Legos. I never noticed her before. She's kind of face down with a ponytail, and she looks like there's no hope. So, some of us may feel like that, but, I always think of the goal as being, we're all driving towards higher quality care. The care has to be efficient. It has to be data driven. And, the word that every time I hear it, I wish somebody would hand me $1 is interoperable, because that's also very important in how we structure our data.
Very much so. And I think the other thing you have to remember with healthcare in particular is the safety of the patients as well. And it makes me think of back when I was starting to do data governance and working out how to do it and how not to do it. I worked in a bank. And I frequently got told one of the big reasons for people not needing to do data governance was nobody's going to die if this data's wrong. Because it's an overdraft on a bank account. We can recalculate the balance, we can recalculate the interest, and it's like it never happened. But we don't have that luxury in healthcare. People really do die if we get our data wrong, and I think that really changes the kind of the focus on the importance of data governance for the healthcare industry.
Absolutely. And, that kind of is a good segue into why do we need governance, and what do we need? We're all being challenged in different capacities and different roles. We're overhauling our health IT systems, how things are being deployed and developed and utilized for, documentation, compliance, reimbursement. There's a lot of regulatory requirements, and something that I found a lot as brick and mortar health systems are trying to reach out into the community. Within the community itself, there's a wide variety of IT maturity that we're being tasked with having to deal with.
Definitely.
In this slide here, even just going back to how I was talking about paper records and charts, patient charts, the data and how we use it are outstripping the capabilities of the supporting architecture, right? We have all this big data coming in, but that doesn't mean the data is all of the highest integrity. If it's clean, is it reliable? Is there a truth there that we can all use and bring out into our organizations? I think that tends to be the big challenge.
Oh, I totally agree. I think that's there's so much more we can do with our data, but only if it's managed correctly.
And, and also, that's where I came into this whole conversation on governance. My thing was coming into EHR systems where physicians were reaching out and they were saying, we want to know what's going on in those EHR systems. And when we ask, like Epic and these other systems, they give us these reports that maybe aren't really answering the questions that we have. And the lead time can sometimes be as long as 2 weeks. So, I learned how to tap into the relational databases and saw firsthand that the different tables were the information was stored. Nobody knew where those were. We had to map it ourselves and figure all that out. And, and a lot of times with EHR systems, when you're a busy clinician and you only have like 5 minutes with a patient, you're doing a lot of cut and pasting. Well, that's really poor data governance in most cases, because if there's an error in there, you've now magnified across, the entire patient record. And also with larger systems as well, they have data standards, and they're really these really discrete data elements, and they're limited input. So you're not able to capture the full patient journey.
Yeah, and you think, what value is being lost, or what things fall down those gaps.
Speaking of things falling through gaps, I just love this slide by Datavant, because, if we're all thinking, well, that doesn't apply to me. If you look at it, the EHR software problem is just in the upper left corner. But look at all the different types of data. And, my favorite, and I know we'll follow up with a more developed definition, but the definition I like of data governance is you have these data assets, and they have a life cycle across your organization, and they have to meet your organization's standards of quality and integrity. And that is different a little bit than what we are familiar with in medicine, where we've kind of known about information governance for a while, because that's where we're taking information, right? We're not just looking at the whole asset, we're looking at information. So we're stringing together data to look at blood pressure history, or weight distributions, or blood glucose levels. It is in the total, when we bring the data together, that we're able to glean our insights. So you can look at this and imagine that if there's an error made in any part of these systems, how that could be exponentially magnified versus when we relied mainly on paper records.
Oh, absolutely. And I think it is when you start aggregating huge volumes of data that say small errors that possibly wouldn't cause a problem on an individual paper record, because you'd be looking at it in its entirety and you'd say, oh, that must be wrong. You don't see it when you aggregate it, but yet those small, tiny differences become a big problem when they're magnified.
Oh, and I forgot, I don't know why this just came to me. There's a Q&A. that you guys could start entering Q&A questions in there. When we get towards the end, we're going to save some time to hopefully answer some of your questions. So if you can just log them into the Q&A chat, then we'll be able to get to those later. Now this I want you specifically to speak to, because this is a summary of everything that you are charged with.
Yes. So top data related challenges. Now, I'm obviously not going to bore everybody by talking through them all, but I think from our conversations previously, Bonnie, this is a slide that's kind of not specific to healthcare, but this is just problems of data. But I think my experience over the years has been that actually there are a limited number of challenges to do with data. It's just the impact of them differs depending on the sector. But I think if you look at maybe say the top 2 or 3 on this slide, insufficient resources to support data initiatives is something that I've seen across every sector that I've dealt with, even ones that have to adopt data governance for regulatory reasons or because of healthcare. People might die if we don't get this right. But time and time again, people either don't allow for the right resources, or they just totally underestimate. I was talking to a prospective client on the phone only last week, and they were talking about just doing a new master data system. They've just gone live, and they're a global organization. And in the UK, it has taken them, they had a team of people working to cleanse and improve the data before they put it in the master data solution. And it took them 3 years to get the data good enough to go into the master data solution. On Go Live, they then discovered that other countries around the world didn't allow enough time or resources to get their data fixed. So in order to meet the deadline, they dumped dirty data in the master data solution, kind of thereby kind of totally undervaluing all the effort to date. So that is a really, really common one. And I think, it's one to be very, very conscious of. Don't think that this is quick and easy. You really do need to dedicate some resources to it. The second one as well is really kind of resonates about this difficulty accessing data from different areas of the organization. I think every new client I work with tells me you've never met an organization as siloed as us. And actually, I think everybody's as bad as everybody else. I don't think I have seen anybody that I would say was particularly worse than anybody. It's human nature. You say, I don't trust your data, Bonnie. I am keeping mine here for my own use. And I'm not allowing you to use mine because I don't trust yours and I don't trust you because what you might do to my data. So you've got that before you even start. And we've got this complication that you already mentioned, and I think we have similar in the UK as well. You're moving from paper records to electronic records. But whilst you're in this kind of state of flux, you still have some paper records, and you're trying to combine them with electronic records, and that's just never going to work, is it? So that is a huge problem, and I think particularly while we still have some paper records that we're relying on, that's going to continue it. And then there's the data accuracy. That is, I think that is the one that goes back to my, people might die if we get this wrong, if we don't annotate on their records properly that they're allergic to certain antibiotics, or there's all sorts of things that we need to be absolutely accurate in our data capture so that when we use it, it's used appropriately and the right decisions are made. So yeah, all the rest of those are valid as well, but obviously in the interest of moving forwards, we have a lot to cover. I think that gives you something to think about, I hope. And the next slide is actually one of my favorites. I use this fairly often with clients. A few years ago, I went to a conference and a chap stood up and did a presentation. And I'll be honest, I think the presentation was probably very good, but English was not the presenter's first language. And he spoke English fairly badly in a monotone. So it was quite boring, but he actually at one point did an image very like this and explained the concept of it. And I just suddenly went, that's it exactly. So as soon as I left that conference, I Googled the image, couldn't find it. So I ended up trying to explain to a very bemused graphic designer what I wanted. And this is what I ended up with. Now I use this to illustrate to clients what is happening when they say to me, we don't have time to do data governance. And I say, why don't you have time to do data governance? And they say, well, because we're so busy running around and trying to sort out all the data before we can use it. And so you say, oh, so it's a bit like you're a farmer, you have all your chickens in a nice little pen in the corner of your farm, except as you can see, there's a hole in the fence. So the chickens keep running around. So you spend all your time chasing and catching the escaped chickens rather than mending the fence. So this means that this is never going to end. You're always going to be chasing chickens because you've never got time to mend the fence. But if however you kind of look at the second picture on the right hand side and say, actually, I'm going to ignore these things for just the half an hour it takes me to fix my fence. I will fix my fence, then I'll put the chickens back in, and then that's it, done. No more chasing chickens. So I like to use this as an analogy when I'm talking to clients, but I do have to be a little bit careful because sometimes when people are moaning about why they don't have time to help me do data governance, I do find myself wanting to say, you're too busy chasing chickens, aren't you?
Well, I like the look on the chicken's face in the first square. That makes me laugh. And this always reminds me, too, of like the analogy of what comes first, the chicken or the egg. What do we do first, big data analytics, or we get a data governance program? It seems like everybody wants to get the big juicy data and to say that they have, all the data, but there really is no governance in place. And, here we are. And when I talk about it in healthcare, a lot of the things that can happen without data governance is, it's very hard to make sure you're actually matching the patient to the right record. I see a lot of duplicates in a lot of the data sets that I look at, and then I have to go back and find out, is this actually the same patient? Some things are inappropriately merged, and you have to fix that. They're incomplete, things are missing, because we need to know what are the current medications. We need to make sure that the records are up to date. We need to know what some of the past procedures are, because if not, these are all opportunities for harm.
Absolutely. And I think that reminds me, and I'm sure it's the same in the US, but in the UK, doctors here take the Hippocratic Oath, which actually says you must do no harm. And that links so well to the top driver there, ensure everybody's working with consistent data. If the data isn't consistent, and say by that we're meaning accurate and the good quality, then you could do harm, because you haven't got all the information or the right information to make the right clinical decisions. So I think that that's obviously going to be, a big thing in the healthcare, and we're never going to be able to get away from that. But I think going back to one of the things you were talking about earlier, the I can't even say it now, interoperability, but these operational efficiencies, and then it's not just healthcare, to be fair. Everybody wants these efficiencies, and they think that if we automate things and put the robots doing things, then it'll all be fixed and we'll all live happily ever after. Well, perhaps I think we're a long way off from that at the moment, but we can only have these standardized, repeatable processes if our data is good enough. We can't expect that everything goes and runs smoothly if we have data missing or the data is wrong in certain areas. So actually data governance, obviously we've got to focus on the health of the individuals, but it should also be a huge driver for operational efficiencies.
Absolutely. And I mean, that's why I love these two slides and to hear you speak about them, because of your broad experience, across multiple organizations. And there's a lot that we on the healthcare side can definitely benefit from as well, because otherwise, what are we doing? We're still doing just record keeping versus evolving towards value-based care, where we actually have the data of a quality that allows us to make the insights. And back to what you're saying about first do no harm, quite often in the absence of good data and while you're waiting for good data, sometimes first do nothing, and sometimes an intervention isn't the first thing that needs to be done, when we're dealing with, gaps in medical records or history or patient charts.
No, that's very true. So the moment that hopefully everybody's been waiting for, don't get too excited though. This is a proper definition of data governance, and hopefully a lot of you on the call will have heard of DAMA or DAMA, depending on which side of the Atlantic you're on, which is the Data Management Association. And they have a body of knowledge that tells you how to do all sorts of data management disciplines, including data governance. But also they do have a dictionary of data management terms. And so this is where we have this actual definition from. And hopefully you've got the impression so far in our webinar, I'm quite enthusiastic about data governance. I'd even go as far as to say passionate. And I think that as a definition is maybe not the most exciting. It's a very fair and true definition of what it actually involves. It's the exercise of authority and controls, shared decision making over the management of our data assets. So yes, it's correct. I wouldn't recommend you use this in your organization. People are not going to get excited about it. I think what you need to do is to turn this into, what does it mean for your organization? What's the outcome? What will happen if your data is better quality and better managed? And then people tend to pay a lot more attention and listen to you. But it's interesting that data governance is actually one of the most misused and misunderstood of all the data management disciplines. So whenever I include a slide to tell anybody about what data governance is, I also include the next one, which is more about the, what it's not, because these are things that it gets commonly confused with. Now, data protection has been a very interesting one the last few years, and I gather that you have not been immune in the US from the EU GDPR regulations, which has changed the data protection rules in Europe quite significantly. Now, up until the 25th of May last year, when it came into force, I actually was really, this was an easy slide. I could say to you, Bonnie, it's okay, because data governance, data protection, nothing to do with each other. They are not the same thing. Data protection is about the privacy of the individual and their data, and data governance is about managing the data and the quality of it. Even to the extreme that our old Data Protection Act in the UK, pre-GDPR, actually said nothing about for the quality of the data. So as long as you protected personal data and didn't give it to people you shouldn't, the data could absolutely be rubbish, but you weren't breaking the law. Now, GDPR has changed all that, and it actually does ask for accuracy of data and accountability in people, and an understanding what it is and where it is and what it's used for. All things that data governance gives you. So it's not so cut and dried now. They are not the same thing. But what I would say is that if you're responsible for data protection in your organization, you definitely need to make sure that the data governance team are on your side, and that all their efforts are aligned with yours. Now, data retention is a bit easier. So if anybody isn't really comfortable about what that is, that's just how long you should or shouldn't hold data before you have to delete it. Now, it's a different discipline, but what I would say is if you've gone to the effort of finding data owners for your data, wouldn't they be the right person to be having a significant input into how long you need to hold that data for operational reasons? Now, data security is the one that probably gets confused the most. And I think, to be fair, that's down to some of the data security software vendors. They think that governance obviously is perhaps a nicer sounding word than security or access management when they're selling their products. But data security is very much the how are we going to protect our data, how are we going to encrypt it, who are we going to give access to. Data governance is nothing to do with that. Although, going back to what I said about data retention, if you have a data owner in place, wouldn't they be the right person to agree how sensitive that data is, who should have access to it? So if I go into an organization to do data governance, it's quite often that the data security manager will find me and say, oh, thank goodness you're here. You're going to make my life a lot easier. I normally chase around the organization trying to get people to make a decision. And then finally, Big Brother. Now, personally, I can't stand the program, but it comes up time and time again when I'm on client sites and I'm helping people do data governance. It's really only a matter of time before somebody will say to me, I bet you're here to look over my shoulder. You're going to be Big Brother, aren't you? You're going to look at everything I do with data, and just be there on my shoulder. And I go, actually, no. I'm not actually interested in your data at all, which really surprises them. I can say, actually, I'm here to help you find out who in the organization here cares about that data. And I'm going to help them to set the rules and work out how we manage it properly. And also, convince all the people, including the person that's accusing me of being Big Brother, that actually that they have some responsibilities and they should be caring about the data. So definitely not Big Brother when it comes to data governance.
And just really quickly, just from my experience on the healthcare side, I find I can get people to listen better if I don't say data governance. If I say a lot of the other terms you were saying, like if you start talking about patient safety, then everyone sits up in their chair, of course. But you can also think of it as cost containment, these changing payment models that we need to get in front of because we're getting pulled along at an alarming pace.
Mm-hmm.
You want to have trusted analytics if you're going to use this data to be the face of your company, or you want it to be used externally. Quality care, every week we all care about, and it also enables trust. And it helps you to, identify where are your pain points also. Is it around the creation of the data, how we store it, how we analyze it, how we report it? And, something really clicked for me the other day when you did mention this, who should be interested in your data. That's really important because a lot of times there's no one in that role at all, but there's all the responsibility in the world in departments, but there's not anybody given the actual specific responsibility.
No, that's very good, and that segues beautifully into the three-legged stool analogy. Now, this was something I had never really thought of making it a three-legged stool until I told Bonnie what I wanted on this slide, and she came up with a beautiful picture of a three-legged stool, and I thought, that's fabulous. I love it. So a data governance framework, I believe quite firmly is made up of three things. So like our three-legged stool, we have a data governance policy, some processes, and some roles and responsibilities. And just like our three-legged stool, I can tell you that it won't be successful if you don't have all three. So to help you get your head around what they are and perhaps why you might need them, I'm just going to go through each one a little bit in time. So policy, I love this. I was a guide when I was a child, so a commitment to do data governance, and that's exactly what the policy is. Now, I would absolutely rather that you go back into your organizations after listening to this webinar and convince everybody the benefits of doing data governance, and they all sign up willingly. But let's face it, one, they're not going to. And two, even if they do, you'll be where I was in the early days of doing data governance. And, you know, you'll agree to do some work for me, and then I'll come back in 3 months' time and say, oh, Bonnie, did you do what I asked you? And you'll say, actually, no, Nicola, this big transformational program's come along. I'm really busy. And I go, but you said you'd do it. And you go, yeah, I know, but there's this, you know, priorities have changed. And I'll go, but you said you'd do it, Bonnie. And sooner or later, Bonnie will get really fed up with me. And you turn around and you say, but do I have to do this? Now, if I don't have a policy, what's the answer? There's nobody's going to come and tell you off for not doing it. So I have to go, well, we should, but no. Okay, I can't make you do it. So hopefully you're getting the message. I would always rather be the good cop. I want to be the person helping the business to do data governance. And I think that is the role of a data governance manager and team. You're not the police, but having a policy is really good, because then you can use your internal audit as the police. And they can turn up and say, so Bonnie, we have a data governance policy. Show us how you're complying with it.
I need a slide about being thrown into the bus.
But it's not the only reason you should have a policy. The other reason you should have a policy is actually it puts down in black and white that your organization has taken data governance seriously. It understands that data is an asset of the organization and needs to be managed appropriately. So, you know, all joking aside about, you know, the good cop and bad cop, is a fabulous one for actually setting that bar and saying we manage our data properly.
And I like when you say it is a corporate asset, you know, and you know, relying on best endeavors, you know, that can't really be your policy to make sure that people who are in a role actually do what they say they're going to do when they say they're going to do it.
No, I totally agree. And it's quite funny, whenever I actually do my training courses face to face rather than like the online version, I always say to people, right, okay, who here has our staff or one of our key assets on your website, on your corporate website somewhere? And nearly everybody in the room put their hands up. And I go, and who here has data as one of our corporate assets on your website somewhere? And I'm lucky if one hand goes up in a whole room of people. So, you know, this is it. It shows that it's a real culture change that we're trying to get people to do, that they're understanding that their data is just as important as any other asset that the organization has. So, once you have your policy, though, you're also going to need some processes. I learned this the hard way in the early days. I could, you know, I was very enthusiastic. I would bounce into your office. I would explain to you why we needed to do data governance. And you go, wow, that sounds fantastic. I'm going to go and fix some data instead of just managing it. Or, you know, doing the manual workarounds, everything that people do to just kind of carry on regardless that the data is not quite good enough. And what I was finding is that people were going off and doing their own thing for the right reasons. They were doing it because they thought they were fixing things, but they didn't know who it was impacting on, and they actually caused other problems to other people downstream of them. So what you do need is some processes, not hugely complicated ones, but just ones to make sure that everybody goes about managing and, you know, improving the quality of your data in a consistent way without kind of, you know, doing any harm to anybody else elsewhere. So doing it from a holistic point of view. And then finally, roles and responsibilities are absolutely vital. And this is one thing I find. I quite often do data governance reviews of organizations. I look at their data governance frameworks and tell them, is it working or not? And the ones that say to me, the trouble is we spent all this time, we've got this beautiful data governance framework, it's well documented, but it's just not working. Before I even start the review, I can normally take an educated guess that it's going to be because they haven't got roles and responsibilities addressed. Now, to kind of illustrate why that's really important, you know, I'm sure you can all think to meetings that you've sat at where we all agree violently that something needs to be done. We don't kind of hesitate. There's no dissent at all in the room. And then we come back next month and Bonnie goes, well, Nicola, did you do it? And I go, well, no, I wasn't going to do it. I thought you were going to do it. Data governance is exactly like those really frustrating meetings that we've all been to. We can't just say we have a policy, we've acknowledged that our data is an asset and we want to manage it properly, and then just expect people to kind of think, oh, well, that must be me then, I'll do that. So the roles and responsibilities are a really clear way of making sure that people know what's expected of them under a data governance framework. Now, we included just this little example. So you don't have to get too worried about it. It's one thing I say. There'll be a test at the end. You know, I'll answer all questions. I believe very strongly that there is no such thing as a standard data governance framework. because you don't all work for standard organizations. Now, this is something I say quite often because it's something I get on my hobby horse about quite a lot. So I wouldn't recommend going and copying this and going, well, that's it, we've got a data governance framework. But I just wanted to share something with you to give you an idea of the kind of thing that you might have on it, and how you can show the roles in it and how they interact. And you know, how if you have a data governance committee, how that fits in and who it might report to. But you can see quite clearly you've got a data quality team in this example, or a data governance team sitting at the center, and their job is to make sure that all of this happens. They're not doing all of it, though. This is the one thing I do always like to point out. Once you start doing data governance, it's quite common for people to turn up at your desk and go, oh, I hear you fix our data. And you know, my answer to that is no, I help you fix your data. If you're the data quality team or the data governance team, you cannot do this on your own. You need to have your data owners, your data stewards. You need to have all these people around the organization actually doing their bit to make it work. Now, the other thing I did want to kind of comment on this while we're on this slide is that I think some people can find this is scary, this is lots of work. So, you know, one of the questions I quite often ask is, you know, how many people is this going to take? Because as we already discovered early on in the webinar, that actually allocating resources is a bit of a problem. Now, I think that you shouldn't get too het up about this. You should just start a data governance initiative with what you do have available, and you can scale it as you grow. One thing I always say is you cannot successfully implement data governance over everything in your organization immediately. That way just leads to madness and lots of headaches from hitting your head against walls. I can tell you this because I've been there. What you need to do is to start small and grow. So have pilots, have proofs of concepts, implement it over one data domain or in one department or function of your organization, and then extend it. And that means that you can actually start to deliver some value with relatively low amount of resource. And you can always scale that once you start delivering the value. And once you're delivering benefits, it's a lot easier to make the case for extra resources. So I wouldn't be put off by the fact that perhaps you're a huge, you know, global organization and, you know, you're the only one person and you can't do it all. No, I totally agree, you can't. Just pick what you're going to focus on first and iteratively develop it. It will work much more successfully. You'll get it implemented better, and you'll help yourself make the case for more resources to expand the program further.
And that's what I really loved our conversations that we've had in the past about this slide too, is the scalability of it. And, you know, almost like if you want to get to a destination, you have to know what path you're on. So sometimes just, you know, having a simple version of this where there is an executive committee or someone that you report to, or, you know, there's just a lot of things here that you can tease out to start wherever you are. And, you know, this next slide kind of introduces, you know, the healthcare edition, you know, where you're going to be talking, you know, a little bit more about what this might mean specifically in the healthcare environment. And, you know, a lot of what has been said already has been around like, well, data governance, that just seems so official for things that I don't even do yet, or we're just a small company, or there's lots of excuses. But what I really like about this quote by HIMSS, and, you know, many of us have been to the HIMSS conference, is, you know, if you are touching data in any way, and we all are, if you're collecting it, updating it, deleting, whatever you're doing, you're accountable. You have accountability for the best data possible, because you also are in a role where you could mess stuff up if you don't know exactly what you're doing. And that's extremely important when we start looking at, you know, the data governance and how it transitions around information governance. You know, a data asset is a broad category, but information is what we do with those assets, right? How do we link different types of data together to garner an insight? We have to look, you know, at just think of a patient record where you're looking at a diagnosis, you have your laboratory, your medications. If all of these live in different charts within your relational database, different tables, different locations, and you want to merge them together to paint a cinematic, you know, view of your patient, how informative is that going to be if we don't have any types of standards or anybody whose job it is to oversee those policies, roles, responsibilities, and all of that?
Oh, absolutely. And, you're just thinking about, all the things that could go wrong. Is quite scary just looking at that slide. Even if you just, the blood pressure readings, if you got the two numbers round the wrong way,
Yeah.
you know, it doesn't bear thinking about, does it? Oh, but, and also the one thing I always like to say when you're talking about data versus information governance is that, data governance is purely that, we've got a blood pressure reading, we have two numbers, and we make sure we put them in the right fields so that it reads the right way. But that's just a blood pressure reading. It doesn't mean anything until you look at it in context. And it's when you put that data in context that it becomes information. So, exactly, that's why this slide is so useful, that if you have the blood pressure reading on its own, we don't know if that's good, bad, or indifferent until we know, is it male, female, how old are they, how overweight are they, and then you can understand, is this a good or a bad blood pressure reading for that person.
And this also, once you can combine multiple data sets with confidence, that's when your data becomes actionable, and it's not just, like I was talking about before, it's not just record keeping any longer. And just, we're not going to hang out on this one that much, but I just want it. This looks like a typical patient journey. So this shows you the complexity, involved in a clinical visit. So if you want to leverage this sort of information outside of your organization in any capacity, these are all places where your data is being created, where it's being exchanged, and all of these are also places where you're going to have to deal with data quality.
Yeah, and you just think if it goes wrong at the very beginning, everything that data flows to is going to be, impacted by it.
Now, I want you all to get tattoos of this with data governance on it, and just realize you need to be able to rely on, no matter how big your company is, your department, whether you're a solo practitioner, you want to be able to rely on a single source of truth.
Absolutely.
And, I really like this because it goes back to that interoperability definition. But as it grows and we can merge different systems together, we really have to know that that information is accurate and reliable. And we don't necessarily want to do that by restricting the discrete data elements in such a way that we can't fill in the gaps for the story. But, this happens. These organizational wide frameworks are important from when, the patient first steps in the clinic, as we looked at in the previous slide, and, well after their discharge, because this is a longitudinal record. And I like this little guy here because, you need information. Maybe the guy in the middle is the person who up to now has been trying to manage this ever-growing data asset without any policy or processing plan. And, any one of us could be any of these other guys. Well, maybe it's over here. Maybe it's over there. Have you looked over there? And actually, this is a good thing. We had a really nice conversation about this. Like, what does too little look like? So, put on your Goldilocks and the Three Bear hat and think about, what that might look like.
Yeah, and I think some people just think that you've got to do everything. And to be fair, in the early days, I considered myself a data governance evangelist, and I wanted all data to be managed and everything to be perfect. And I believe we'd all live happily ever after then. It doesn't work that way. I've kind of grown up a bit and had lots more experience since then. So I don't believe that, obviously we are aiming for the just right. We don't want too much data governance. We'll stop anybody doing their work. And too little sounds like a bad thing, but I think it's better to get started than to have nothing.
And this guy is, back to that, like, starting with where you are. I mean, I think the titles of these guys just crack me up. There's the livestock directional consultant, and that kind of speaks and leads really nicely into the what does too much data governance look like as well, because that can be harmful.
Oh, and I think that's what people worry about particularly when I was in my evangelist days. And I think it's easy. People suddenly, you have this light bulb moment, you realize you need to do data governance, and you start telling everybody you're going to manage and control all the data, and everybody just panics. You're going to stop them being able to do their work. You're not actually going to be able to look after any patients because you're going to be too busy filling in forms. A very true story. My father-in-law is very poorly in hospital at the moment, and we were visiting him yesterday, and we were in a bay with 4 beds, and the nurse came in to do the drug round, and it took her half an hour to do the drugs for 4 people because she had to keep changing screens, that she had a mobile laptop on a trolley with her, and she kept doing this and clicking on this and filling in this. Now, my mother-in-law actually used to be a nurse, and she just kept sitting there shaking her head, and she said, I could have done this in 10 minutes and been gone, and done all the care and all the rigor to make sure that people had the right drugs. So it felt like, particularly in the hospital yesterday, there was too much governance and rules and procedures stopping people doing the job, which was nursing, not filling in forms.
And, that speaks back to a lot of the, too much silo of the data can impede care. And that's just kind of why I put this little pause in here. I actually really like this slide a lot, as Nicola knows. I just like, you want to put some bones on the patient, right? I mean, some meat on the patient, flesh out the picture. You want a more complete picture. And in order to do that, you need to be able to trust the integrity of all the data elements that you have on hand so that you can make inferences. And here, really quickly, just because, it's not fair to like make you aware of something and then not share with you possible resources, or even from a tool. A lot of you are even probably from the Tableau Health Group user environment, or people who will be looking at this later. And, there are processes, the only tool I've ever used, and now actually, is Tableau, but I have been migrating a lot of clients over to AWS, where they work with Tableau as well, just because of the size and the scale of the data elements. But, a Tableau server environment can do a lot of the things that we're talking about. But obviously, for that to be successful, you need to have people whose responsibility it is to provide the data services, or for oversight around the application or the repository. So I just leave this with you, obviously not as a, set it and forget it, but just a conversation around a high-level architectural view. And there's another one I share more in my face-to-face trainings that I do, where we actually look at AWS and how this data moves through those systems. So just really quickly, those of you familiar with Tableau know how you can have data, at your fingertips. And there's an admin side to things too, where you can regulate where the data might live. You can also be able to see where the data is coming from, something about retention. How old is this data? How often do we refresh it? How reliable is this data, prior to a refresh? Who is overseeing the scheduled tasks? So these are certain things that can be answered in a Tableau online environment or a Tableau server environment. And within that, most of you are familiar, if you use Tableau at all, that their model includes different levels of interactivity. Because let's face it, we're all not going to sit down and start from soup to nuts creating a data visualization. Some people are the creative side of things. Some people are the explorers. They want to go in and look for insights. Hypothesis generating, hypothesis confirming, and these are all different levels of engagement within the Tableau environment. And anyone can reach out for more details, after the call. I just want to make sure, as we move through these final slides, that we have time to talk about some of the questions. But Tableau Viewer also has a level of engagement as well. But Tableau as a company has done very well of just putting the data in the right hands, in the right capacity, and the right technical levels. And, functional goals. This is going to lead into where we'll talk a little bit about maybe some horror stories or how you can get started. But, what are we missing within this functional goal environment, right? You need data stewardship. We need standards and how we handle our metadata, lifecycle management. This is all maybe more specific to, healthcare and the way that I'm articulating it, but this is kind of generalizable to other industries as well. And
Definitely.
This goes back to our bucket of Lego people. Now look at it. So they've all, turned and morphed into this beautiful symmetrical building. And, that's kind of, where we are. And what we're hoping to do is to build awareness around this. And, I never like to leave people with, more anxiety around like, oh no, look what I'm doing. So, we wanted to be able to have a pause here where we can talk about possible ways for you to get started.
Yeah, and I always like this image because it kind of captures what you've just said, Bonnie. Is is that how you feel when you kind of somebody points to you and say, yes, you, Bonnie, you're responsible for doing data governance at our organization. But it's also one of the ways that, how you get started. You're going to have to find some real pain points, because to do it for all the generic benefits, people will tell you that it hasn't been a problem at your organization before. Nobody's died yet because of your data. People are going to put up all these hurdles in place. So what you need to do is actually go and find what I like to call your data quality horror stories. What has gone wrong in your organization that has caused some pain? Hopefully not people dying, but there's a huge thing going on in the UK at the moment about contaminated blood that was given to people 30 odd years ago that gave people hepatitis C and HIV. That must be a humongous data quality horror story for any number of healthcare organizations, and that they're still got the legacy and the impact of that. So I'm hoping that for your sakes you don't have such horror stories of that magnitude, but go and find out what pain points have you got, what goes wrong, and what pains are felt in your organization, because you can use them to say, look, our data isn't good enough and we're having this go wrong because of it. And that really helps get people to listen to you and understand that you're not doing data governance because you're an evangelist, that you're doing it to fix problems. It makes me think, actually, back in the early days of doing data governance, one of my colleagues in the wider team turned to me one day and called me a data princess. And I was really chuffed. What a lovely role. I quite fancied myself as a data princess. It sounded rather glamorous, didn't it? Then my bubble was burst about 30 seconds later when my colleague said to me, yeah, you do know he didn't mean that as a compliment, don't you?
Mm-hmm.
And I went, oh. I was really quite there visualizing myself as the data princess. And it took me a little while, and then I actually worked out what he was talking about. I was stuck at the top of my ivory tower, and I was preaching the benefits of data governance, and why don't you all come and join me, and we're all going to live happily ever after, and wondering why nobody came and climbed my tower and saved me and saved the data, kind of thing. So, and being a data princess doesn't work. You need to get out there, roll up your sleeves, find the data problems, and work with these people to help them solve them. And it's the only way you really are going to move forwards with your data governance. So I wrote a blog on it many years ago, and I said, you can't be a data princess, you've got to be a data knight. You've got to be out there fighting the battles.
Well, I was called, this could speak to our different personalities, but one of my last client meetings I had recently in pharma is they called me Datazilla.
Excellent.
Which I thought, oh, if I'm Datazilla, then I'm doing my job right. You didn't bring me here into this very large boardroom with all of these important people to have me, clap my hands and say, well done, you. You wanted to know, what assets are you not managing and why we have preclinical data that doesn't talk to our phase 1, phase 2 data. And, it was a very productive meeting, but I did earn that. But I'm going to own it. I'm going to embrace it.
Why not?
Now, there was a question which we sort of touched on, and I want to hear your feedback about a question that they're asking about: is there an example of a data governance strategy? And that always there's good and bad to that sort of thing. There's that template where people might just want a place to start. And then there's also a way of generalizing data governance into one thing when it is actually many. But I wanted to hear your thoughts on that.
Yes. And this is a tricky one, because I totally get, if you've never seen a strategy, how would you know where to start? But I'm not so worried about data governance strategy being a really big formal document. It should be forming part of a data strategy that as a data governance team you're not responsible for. But what I would say is, resist the temptation to look at somebody else's. So one of my clients, I go into quite regularly. I hadn't been for a while, and I went at the end of last year, and I said, "Oh, we've been working on a data strategy." And I went, "Oh, that's nice." And they went, "Can you look at it for me?" And I said, "Oh, okay." And I was reading it, and it was, I couldn't, it almost like was just totally out of context with the organization. And I've worked with them a lot, so I knew the organization. And I kept thinking, but this document was familiar, and it was saying things that were not relevant to that organization. And it niggled at me. And in the end, I suddenly realized that I'd been doing some work as a joint venture with another consultant with some universities in the UK. And he'd written a data strategy a few years ago for a university that had shared it publicly online. And my client, who was not a university, had picked this up and just done a cut and paste. And it just, vast swathes of this document were not relevant to that organization. And she asked me to look at it because people were not taking it seriously. And I could see why. And she'd actually missed a couple of bits where they'd used jargon that was specific to the higher education sector. And that's like me sending you a document written for a bank and you expecting it to work for a healthcare company. So I try to say, don't copy somebody else's. It's harder work to write it from scratch, but it's much more rewarding. You'll have something that's much more successful. Not about a strategy, but I wrote a blog about how to write a good data governance policy only last week, covering the same kind of theme. Don't copy somebody else's. Go and write your own one from scratch, and giving some ideas on how to go about doing that.
And there's another one too, like another question. Do you recommend policies be defined at the data element level, or should it be a higher, more general level? I have my thoughts, but I'm going to punt that to you first.
Sure. Now, I think being a bit of a data governance geek, I have this thing about definitions, and I think that question has come about because of the definitions not being clear. So when I talk about policy, so I'm very glad that you asked the question, thank you. I'm talking about the high level corporate policy that says we manage data as an asset, all data has a data owner, that kind of thing. But I do often have debates with people because they're talking about policies at a data granular level. So for that, I usually use the word standards so that I don't confuse myself, let alone my clients. So I would say have one policy organization-wide that says this is how we manage our data at a higher level. And then you're not going to want standards or policies on every single data attribute you have, because not all of your data is important enough for you to want to do that level of monitoring and control. But yes, I would work out what is your critical data and write individual standards or policies. What makes that data good enough for you? I mean, is the date of birth of a patient absolutely vital? In which case, write a policy that says it's mandatory and it has to be in the following format, just as a kind of example.
That's where I was going to leap in, because I'm always on the analysis side of all this. So I kind of see what the outcome is where they don't define the data element level, and I have to figure out and find a common way to combine data that's really describing the same thing, but doing it in a really bad manner, like how we capture birth dates, how we, there's just a lot that comes in that's so dirty that could be prevented upstream. And that leads to the question, data entry is still the weakest point of data quality. How do you address it? I feel like that's about standard. That is about standards and having appropriate, and I may use the term differently, but a data dictionary where things can't get entered in if they're not reaching a certain level of integrity. But having said that, there's a lot of tools now like Tableau Prep. If you can write any code in R, I've written very simple lines of code that can go in and pull out the problems with a poorly formatted email address and find out the one that's all the variants. There's ways to handle data entry and cleaning. And I did want to make sure this question goes right to you about, because it's your favorite question. You ready? Can we say data governance is a subset of data management initiative?
Oh, good question. And that's a nice, easy answer. Yes. So for any of you on the call, I mentioned Dharma or Dama earlier. They have it's called their Dharma wheel. And it's like it's a circle, not surprisingly, being a wheel. And in the center, you have data governance, and then you have in segments all the way around it lots of different data management disciplines like data modeling, data architecture, data quality management, master data management. Now, I love the Dharma wheel. I use it a lot to educate people and show how it all fits in, but some people do see data governance in the middle, not thinking that it means it's underpinning all the other disciplines, but they think that data governance and data management are interchangeable, and that is not the intention of that Dharma wheel. It is meant that data governance is just a subset of one of the many data management disciplines.
Yes, and I want to give us this last little conversation that we can wrap on. Well, actually 3 things. There's a question about the data horror story is a good grounding question to ask. And so we're being asked, like, what are some other ones? And I can do my quick answer, and then I'll leave this all with you. I'll leave this all with you to be the final voice on these things. But, you know, a lot of times I ask, and this usually stops everyone, what sorts of data questions are you trying to answer? And a lot of times, you know, people don't know. They don't really have an idea. And thinking about the data questions is a very important way to think about what types of data are going to be needed, what sorts of data sets are going to need to be merged to be able to answer these sorts of questions. So that question, if you could add to that. And I also wanted to make sure you get to your checklist before we have to go.
So I agree with you. Those are good questions. And I would actually say it depends on your audience. But I would, if I was talking to somebody who's not very good at, you know, data, perhaps they are not data literate, as Bonnie was mentioning earlier on in the webinar, I might even just say, what are your challenges in doing your job, running your department? Because quite often I find if you say to people, what are your challenges with data? They just look at you blankly and go, we don't have any. But if you say, what challenges do you have? They'll start saying things like, well, we get this spreadsheet from so-and-so and it's, you know, inconsistent format, or the data's missing. And they start telling you, but they're not thinking about data yet. And you have to help them get their head around it in the first place. So, yeah, so that's kind of one of the good questions. But I think it's generally be a really good listener and a really good business analyst and ask lots of good questions. But you mentioned my checklist. I do have a checklist which I've developed over the 16 years of doing data governance. And obviously I don't need to look at things and you know, tick it off every time I help clients do data governance anymore. So, but I thought it was a bit of a shame that it was sitting on the shelf not being used anymore. So I do actually have a high level version of it that I do make freely available. So we're going to make sure that's sent out with a recording of this afterwards.
And there will be, the recording will circulate, and you can look to us for that. And if you have any ideas, you know, we have lots of ideas about, you know, other projects and other discussions we want to have, maybe even do something live in person, like a face-to-face where we can actually tackle real problems in real time. And, you know, thank you so much for your time. And you'll be hearing from us with a link to the copy of the recording. And thank you for your time.
Thank you.